Are you doing your Kegels every single day? Have you cut out coffee, spicy foods, and everything else you were told might be causing those frustrating bladder leaks? You have followed all the advice. You've tried to strengthen your pelvic floor, but the problem isn't just going away. For some of us, it's a leak when we sneeze or laugh. For others, it's a sudden, overwhelming urge that sends us scrambling for a bathroom. It's incredibly common, affecting up to half of all women and plenty of men too. Yet, we are often told it's just a simple matter of weak muscles. But what if I told you the cause might not be weak pelvic floor muscles at all? What if the real problem has nothing to do with your bladder itself? Yes. What if the real problem has nothing to do with your bladder itself, but it is an actual sign from your body that something much deeper, something systemic is happening? Often, bladder leakage is a symptom of a deeper issue that most people and sometimes even doctors overlook. It is a warning light on your body's dashboard you can't afford to ignore. Welcome to another episode of Unfiltered Truth. Welcome. Yeah. In this video, we are going to uncover 5 shocking reasons your bladder might be leaking that have nothing to do with just doing more exercises. We are going to pull back the curtain on the hidden causes that connect your bladder to your nerve, to your spine, and even to the medications you take every day. Yes, the medications you take every day. And reason number 4 might just be the key you have been missing, especially if you are being treated for other common health conditions. Stick around because understanding these root causes is the first step to getting real answers and lasting control. Before we jump into our 5 shocking reasons, let's quickly get on the same page about how your bladder is supposed to work and the different ways it can go wrong. This is so important because once you understand the system, you will see how the other health issues can throw it completely off balance. Think of your urinary system as a highly coordinated team. Your bladder is a muscular sac, a reservoir that stores urine. Supporting it from below is your pelvic floor, that muscle group that is often called hammock, that is holding everything up together. When your bladder is filling up, its main muscle, the detrusor, is relaxed. At the same time, a gatekeeper muscle, the urethral sphincter, it stays tightly closed together to stop any leaks. The real boss of this whole operation is your nervous system. Your brain and your spinal cord are in constant communication with your bladder. Nerve in your bladder wall will send signal to the brain that it is filling up. That is when the gatekeeper muscle will tighten up to prevent any leakage. When you decide it is time for you to pass urine, when you decide it is time for you to go, your bladder would send another signal to the brain saying it is time. Then it will allow the bladder wall to squeeze and it will allow your sphincter muscle to relax for you to be able to pass urine. When that coordination is perfect, then you have complete control. But when it is not, we see different types of incontinence. The most common is stress incontinence, when you leak urine, when you cough, sneeze, or laugh. The other one is the urge incontinence, when your bladder muscle is powerfully contracting without your permission, giving you the I gotta go feeling now, like you need the toilet right away. The other one is the overflow incontinence, where your bladder is not completely emptying and it is filling up very quickly, overflowing, leading to urine leakage. Most advices focus on strengthening that pelvic floor hammock, but what if the problem is not the hammock? What if the problem is with the team manager, the nervous system, or something else that is completely flooding the system? That is exactly what we are about to get into today. The first shocking reason your bladder might be leaking has nothing to do with your bladder muscle, but it has everything to do with your back. The problem might actually be starting in your spinal cord, a condition known as neurogenic bladder. Think of your spinal cord like a main information highway connecting your brain to your bladder. Signals are flying up and down the highway 24/7, managing everything from sensing fullness to coordinating urination. But what happens when there is a roadblock or a breakdown on that highway? This can be from a major spinal cord injury, but it is also caused by much more common issues you might not connect to your bladder at all. Think about a herniated disc, spinal stenosis, which is a narrowing of the spinal cord, or even nerve damage from past back surgeries. This condition can physically squeeze or damage the very nerve in charge of your bladder control, scrambling the signals. This leads to what the doctor calls neurogenic bladder, where the bladder control is messed up because of this neurogenic problem. And depending on where the damage is on that spinal highway, the symptoms can be completely different. If the injury or damage is higher up on the spinal cord, it leads to what we call overactive bladder. This is where the local reflex loop in the spine take over without the brain's calming influence. This is where the bladder muscle contracts uncontrollably, where you have intense urgency, frequency, and even leakage. This is a classic urge incontinence, where you feel like you need to use the toilet even when the bladder isn't full at all. But if the damage is lower down around the sacral region of the spine, the symptoms is opposite. The signal telling the bladder to squeeze can get weak or be lost entirely. This is what we call underactive bladder. You might have a hard time starting to urinate, a weak stream of urine, or the feeling like you've never emptied your bladder. Because it doesn't empty right, it gets too full before it starts to leak. That is what we call overflow incontinence. This is especially dangerous because urine that sits in the bladder for too long can lead to repeated urinary tract infection and kidney damage over time. So if you have history of back problems from years ago and you are now struggling with bladder leakage, it is probably not a coincidence. These two could be deeply connected. The problem isn't a weak bladder, it is a communication breakdown starting in your spine. We usually think we know the main signs of neurological event like stroke, weakness on one side of the body, trouble speaking, or vision problems. But one of the most common yet least talked about long-term consequences is loss of bladder control. And this isn't just from stroke. Conditions like multiple sclerosis, Parkinson disease, and even past brain tumors can all mess up the delicate wiring that controls urination. To get the why, think of the higher center of your brain, like the frontal lobe, as a social filter or command center for your bladder. While the basic reflex to pee is being managed lower down in your spinal cord, the brain provides the all-important hold-on signals. It's the part that says A is not a good place or a good time to pee. It is what lets you sit for a movie or a long meetings without having the boat for a bathroom every 20 minutes. When conditions like MS, Parkinson's, or stroke damage these higher brain centers, that hold-on signal get lost. The brain power to suppress the bladder urge is gone or it is weakened. The result is a condition called neurogenic detrusor overactivity, where the bladder muscle basically goes rogue. It contracts whenever it wants to, leading to sudden, powerful urge and major urine incontinence. You are not losing control because your muscles are weak. You are losing control because the command center in your brain that is supposed to say stop has been damaged. For people with Parkinson's, the issue is being made worse because the disease affects dopamine, a chemical that is vital for smooth muscle control everywhere, including the bladder. This can create that same overwhelming urgency. In conditions like multiple sclerosis, the nerve damage can happen anywhere around the brain or the spinal cord, leading to mixture of symptoms like urgency or inability to completely empty your bladder. It is not just about the control signals. In some neurological conditions, especially those that affect the cognitive function like dementia, the awareness of a full bladder might be impaired. And the person might not even recognize the signal that the body is sending until it is too late. The problem isn't a faulty bladder or a misfiring nerve. It is a breakdown in the brain's ability to even get the message. So if you or someone you love have any history of neurological conditions, ongoing bladder problems should be seen as a direct symptom of that condition, not as a separate random issue. And if any of this is starting to sound familiar, take a second to hit that subscribe button. We put out content just like this to empower you with health knowledge you might not hear anywhere else. And if you know someone who has been struggling with leakage in silence, please consider sharing this video with them. You never know whose life you might change. For millions of people living with diabetes, the focus is usually on blood sugar, diet, protecting the heart, and the eyes. But one of the most common and overlooked complications of long-term diabetes is serious bladder dysfunction, a condition known as diabetic cystopathy. This isn't just a small side effect. It is a direct result of how high blood sugar slowly affects the nervous system. The process is slow and snaky, and it happens in two main phases. In the early stage of diabetes, or when blood sugar is out of control, high glucose in the blood spills into your urine. This forces your kidney to produce a much larger volume of urine to flush out the extra sugar. Your bladder has to work over time, constantly filling and stretching. This leads to the first symptoms where you need to go to the toilet all the time and you wake up multiple times at night, nocturia. At this point, you might think you are just drinking too much, but it is actually your body trying to deal with the excess sugar. But it is the later stage that is truly shocking and way more damaging. High blood sugar causes widespread nerve damage known as diabetic neuropathy. We hear about this causing numbness in the feet, but that same thing affects the nerve that controls your bladder. That sensory nerve inside your bladder becomes numb. This means that the bladder lost the ability to feel when it is actually getting full. You stop getting the normal signal that it is time for you to find a toilet. So the bladder can stretch to hold a massive amount of urine, sometimes double what it should. This constant overstretching makes the bladder muscle weak and flabby, like a worn-out rubber band. When you finally go to the toilet to pass urine, the weakened muscle can't squeeze effectively to let the urine all out. And you are left with a lot of residual urine thinking you've emptied your bladder. This stagnant pool of urine is a perfect breeding ground for bacteria, leading to recurrent urinary infection, which is just making the urine incontinence worse. Eventually, the bladder gets so full that it can't hold another drop of urine, resulting in dribbling of urine. That is overflow incontinence. The diabetic bladder is a dangerous mix of poor sensation, weak squeeze, and chronic retention of urine. It is a silent problem that many people don't connect to their diabetes until serious, often irreversible damage has been done, not just to the bladder, but potentially to the kidney as well. Now, for the reason we teased at the start. If you're one of the millions of people using medication for high blood pressure, heart failure, or fluid retention, the cause of your bladder problems might just be sitting in your medicine cabinet. Yes. I'm talking about a class of medication called diuretics, often known as water pills. Common examples of this drug are furosemide and hydrochlorothiazide. These drugs are fantastic at what they do. They work on your kidneys to flush out excess salt and water from your body, which helps to lower blood pressure and to reduce swelling. But here is the shocking part. Their main job is to allow your body produce a much larger amount of urine and to produce it very fast. This sudden flood of urine can completely overwhelm your bladder ability to cope. It isn't that your bladder suddenly got weak or your pelvic floor muscle gave out. It is that it is being hit with a tidal wave it was never meant to handle. Taking a diuretic makes your bladder fills up very fast, giving you the sudden urge for the toilet all the time. For many people, especially the older adult who has a weak sphincter, the increased pressure alone is enough for a major urine incontinence to happen. The timing of your pills is also a huge factor. Taking your diuretics late in the day can lead to nocturia. It can lead to that sensation where you need to get up every now and then overnight to pass urine, which is affecting your sleep and your life altogether. And sometimes diuretic effects can also lead to dehydration if you are not careful, which makes your urine more concentrated, further irritating the bladder lining and leading to more symptoms of urgency. The link is so strong for some patients. Taking diuretics can increase the risk and symptoms of urinary incontinence. The tragic irony is that so many people get frustrated with the leakage that they want to stop their heart medication or their blood pressure medication, leaving them in serious health danger. That is why it is absolutely critical not to stop any prescribed medication. Instead, have an open conversation with your doctor. The solution might just be changing the tablet you are on or changing the dose you are on just to help balance both your blood pressure and your urine symptoms. Our final shocking reason is one of the most complex, but it is the perfect example of how bladder control is all about coordination and not just strength. The issue is a neurological misfire called destrusor sphincter dyssynergia. In DSD, the synchronization of your bladder completely falls apart. It is like a traffic jam. The bladder is squeezing powerfully to let the urine out, but instead of opening, the sphincter muscle mistakenly slams shut. Imagine flooring an accelerator and brake in your car at the same time. That is DSD. The bladder is pushing against a closed door. This creates a huge amount of pressure inside your bladder, a pressure that can cause the urine to leak out in a random burst. But most importantly, it stops the bladder from emptying the right way. Over time, this intense back pressure can become extremely dangerous. It can force urine to go back to your kidney, leading to severe kidney damage, infections, and kidney failures. This condition is almost always caused by a neurological disorder that messes up with the signal between the brainstem and the spinal cord, where the coordination is being managed. It is most often seen with people with spinal cord injury, and it is also a complication of multiple sclerosis. This is maybe the most shocking reasons of all because it proves that the problem isn't just weakness. In fact, the bladder might be squeezing with incredible force, but the problem is a total failure of communication in the nervous system. Without proper diagnosis, just doing your Kegel exercise would be completely useless and could even make things worse by tensing up those muscles that desperately need to relax. So let's do a quick recap of the 5 reasons your bladder might be leaking that have nothing to do with a weak pelvic floor muscle. 1. Your spine could be sending a scrambled signal because of herniated disc or other back problem, creating neurogenic bladder. 2. This can be the silent aftermath effect of stroke, MS, or Parkinson's disease. 3. The hidden nerve damage from a long-term diabetes. 4. Your heart or your high blood pressure medication. And 5. The neurological traffic jam. The single most important thing to take away from this video today is that bladder leakage is not just some simple muscle problem that you should be embarrassed about or trying to fix on your own. It is a real medical problem, and it can be a critical warning sign for a serious issue affecting your nerve, affecting your metabolism, affecting your spinal cord, or affecting your brain. This message here is one of hope and empowerment. You don't have to suffer in silence, and you definitely don't need to give up on the things you love to do. The first and most important step is to take this information and talk to your healthcare provider. Getting a real diagnosis is not just about stopping a leak, it is about protecting your overall health. Finding this underlying cause early can prevent a serious complication down the road, like recurring infection or permanent kidney damage. Write down your symptoms. Mention any of the conditions we talked about today, and list all of your medications. Be your own best advocate. Getting control over bladder leakage isn't just fixing a leak, it is about getting your life back. Thank you so much for watching. If this video was helpful, please give it a thumbs up. And don't forget to subscribe for a more deep dive into your health. We'd love to hear from you in the comment section. Share your experience, share your questions, share your journey. You are not alone in this.